Hello everyone, I am Dr. Visula Abeysuriya, Senior Lecturer in Immunology at Institute of Biochemistry, Molecular Biology and Biotechnology, University of Colombo. Today I want to briefly discuss with you one of important diseases which you are already very familiar with. That is none other than COVID-19. I would like to briefly summarize you all on two aspects. One is the immunological aspect, other one is the public health perspective. If you take COVID-19 infection, it is a communicable disease. It is an infectious disease. When you go back to the history, SARS-CoV-2 virus has been identified from China in the first time in 2002. Then, second time it has been identified in Middle East, we call MERS, in 2012. Both disease incidents, it has not been a pandemic and threat to global population. Unfortunately, in 2019, we all know it was become a pandemic, a new variant, SARS-CoV-2 virus, we call COVID-19. It has high morbidity and mortality. Now, what is the issue at present? As you all heard, there is a new variant has been occurred. What do you mean by a new variant in SARS-CoV-2 virus? For your understanding, as we all know, virus has a special element we call spike protein. When there is a mutation or change, genetic change in this spike protein, we call it's a new variant. The new variant which has been identified, this time scientists has confirmed that it is a change of a spike protein. So when you heard of a new variant, there are a few questions rising in your brain. First, how this new variant tackled by human immunity system? Second, are we in a safe position? That means our health system, our immunity system can cope up with this. So I would like to briefly describe our immune system. It's a very complex system and it is the army which we have to fight with pathogens. Mainly it has three components: innate immunity, adaptive immunity and complement system. As you all know, when viruses enter to the body, our white cells and antibodies are fighting with these viruses and kill them to protect our health. Now there's a problem. When you get a new variant, how our immune system tackle this? As you all know, when you expose to a virus, our immune system will get adapt to that. He will recognize this thing. And when this virus again entered your body, if this is the same virus, our immune system can easily fight and destroy the pathogen. But when you get a new variant, there's a chance this new variant can slip from the immune system. But don't worry, because still our immune system has ability to partially recognize this pathogen. So there's a protection. So if you got COVID, if you infected with COVID, and if you have been properly vaccinated with the COVID vaccine, you have a still good protection against new variant. You won't get severely sick. You are rarely get hospital admissions. And if you have comorbidities, you still protected from getting severe COVID infections. That is the main advantage of our immune system and our vaccination program. When a COVID infection occurs in a country, if you take Sri Lanka, we have to see it in a public health perspective, because preventive care is more important. I am not saying preventive care is only the option, you have to go for the curative care as well. When you think of preventive care in a public health perspective, main thing is you have to have a good surveillance system. I must truly thank Ministry of Health and other institutions has playing a pivotal role in surveillance. This surveillance system can be improved by adapting artificial intelligence technology, which help quick identification of hotspots, where you can implement more health facilities to those areas. Second most important thing is awareness among people. As we all know, preventive measures. If you are sick, if you have upper respiratory tract infection, if you suspect any COVID infection, you have to wear a mask. You must clean your hands. You must practice good hygienic practices. That is very important. Other one is awareness on people on symptoms and signs, and when to seek medical advice. As you know, when you get sick, you must take a good rest. You must have adequate fluid. When you think you need to seek for medical advice, you have to seek for medical advice. Those are the very important things when you are dealing with the infection. Apart from that, having a good nutrition status, less mental stress also plays a pivotal role in managing and dealing with COVID infections. Not only that, if you get COVID complications or any other complications which need to deal with medical intervention, you must, without any hesitation, you need to take doctor's advice. So in this small brief, I want to highlight another very important aspect in a public health perspective, that is development of research is very important. Evidence-based medicine is a global trend. As a country, we should invest more and more facilities to develop research and development of COVID, which will go up to finding new vaccines and medicines. So as a conclusion, I can tell you, don't think you all are helpless, because all have been vaccinated properly, all have been get COVID infection in some times of their life. So till your immune system is very strong to detect, you are in a very strong position, no need to panic. Finally, I can tell, stay safe, stay clean, and practice good hygienic, and it will help to yourself, your family, and betterment of Sri Lanka as well. Thank you very much.